1918, 100 years ago, a devastating war is at last coming to an end. But amid the celebrations, a shadow is spreading. A deadly virus that would infect a third of the global population. Called the Spanish flu, it claimed more lives than the war itself. 20 to as many as 40 million people perished in every corner of the world. Today, influenza is still a threat, but vaccines are now available to combat it and other dreaded diseases. Smallpox is gone. Polio and measles are greatly diminished. And while communicable diseases continue to wreak havoc, exacerbated by natural disasters, inadequate infrastructure, and air travel allowing infection to hop from country to country within hours. For the first time in history, more people are dying of non-communicable diseases than infectious disease, which has led the World Health Organization to form a new high-level commission comprised of heads of state and ministers, leaders in health and development, and entrepreneurs. The group will propose bold and innovative solutions to accelerate prevention and control of the leading killers on the planet, non-communicable diseases. NCDs kill more than 36 million people each year. Globally, that's 7 in every 10 deaths, and some 80% of all non-communicable disease deaths occur in low and middle-income countries. They include type 1 diabetes, which has been rising sharply since the middle of the 20th century. Combined with the ever-increasing incidence of type 2 diabetes, the World Health Organization reports the number of people with this disease has gone from 108 million in 1980 to 422 million in 2014. Cancer continues to be a leading cause of mortality worldwide, linked to 1 in 6 deaths. 70% of those deaths occur in low and middle-income countries. Iron deficiency anemia is a public health condition of epidemic proportions, the most common and widespread nutritional disorder in the world. The WHO says 2 billion people, over 30% of the world's population, are anemic, many due to iron deficiency. This condition can lead to maternal deaths, poor pregnancy outcomes, impaired physical and cognitive development, and increased risk of morbidity in children. But the world's biggest killer continues to be the group of ailments known as CVDs, cardiovascular diseases. They are responsible for 31% of all deaths worldwide. 3 out of 4 of these deaths occur in economically challenged countries, where people are less able to access effective detection, preventative care, and emergency treatment. Still, the loss of human life from NCDs spares no one, rich or poor, young or old, and it imposes heavy economic costs on nations. Yet non-communicable diseases are often preventable through effective and relatively low-cost interventions that tackle risk factors shared by many of them. As laid out in the WHO Best Buys publication, these include reducing tobacco use, improving unhealthy diets, increasing physical activity, and reducing the harmful use of alcohol. If the major risk factors for NCDs were eliminated, about 3/4 of heart disease, stroke, and type 2 diabetes would be prevented, and 40% of cancer would also be prevented. The scientific and social responses to public health crises in the last century prove that humanity is capable of meeting the needs of the next. Discoveries and advances now being made could transform the future if we unite to cure. The need for a global health care initiative is now more urgent than ever.